16 out of 32 beds.
Yes.
Roughly how much of that is Maine Care?
Actually, all of our youth are Maine Care.
100% of Maine Care?
Yes, that's correct.
Okay, thank you.
Yes.
Seeing no other questions. Thank you. Testimony and support in the room.
Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee. My name is John McAniff, and I'm the Chief Financial Officer at Sweetser, a nonprofit behavioral health provider that has served Maine children and families for nearly 200 years. I'm here today in strong support of LD 2125. I want to be very clear about what this bill is responding to because it is not a theoretical problem. Over the past 3 years, Sweetser has experienced operating losses totaling approximately $2.4 million in our children's residential care programs. These losses were not the result of mismanagement or declining demand. They were driven by Maine Care reimbursement rates that do not reflect the true cost of 24/7 residential services, rapid wage inflation for a historically underpaid workforce, and rising operating costs across food, utilities, insurance, and regulatory compliance. As a result of these sustained financial losses, Sweetser made the difficult decision to close 2 residential facilities, eliminating 16 beds from Maine's already strained system. These closures were not just balance sheet decisions. They had real human consequences. Children lost access to care close to home. Remaining programs, emergency departments, and families experienced increased pressure. Staff faced unsustainable pressure and burnout as resources tightened. Workforce challenges were a major driver of these losses. Because reimbursement rates did not allow us to remain competitive on wages, turnover increased, staffing shortages became more acute, program stability was compromised, increasing risk to both clients and staff. At a certain point, operating under these conditions becomes unsafe, not just financially unsustainable. LD 2125 recognizes that time is the critical factor. The proposed $1 million stabilization fund is not a long-term solution, but it is an essential stopgap to prevent further irreversible losses. From a financial perspective, this is a prudent investment. We know that the cost of closed residential beds does not disappear. It simply shifts to emergency departments, out-of-state placements, and higher cost systems. Once residential capacity is lost, it is extraordinarily difficult and expensive to rebuild. If LD 2125 does not pass, I am deeply concerned that the remaining handful of providers will be forced to make the same decisions Sweetser already has, meaning fewer in-state residential beds, longer waits for care, more children languishing without proper treatment in emergency departments, and greater overall cost to the state of Maine. Sweetser's experience is not unique. It is emblematic of what is happening across the children's residential care system. LD 2125 will help stop the immediate bleeding. This bill is targeted, responsible, and urgently needed. It gives providers a chance to stabilize while broader reforms, such as the recent addition of this program area to the rate determination schedule. On behalf of the children and families we serve, I respectfully urge this committee to support LD 2125. Thank you for your time, and I would be happy to answer any questions.
Thank you. Thank you for being here. Questions? Yes, Representative.
Thank you. All right, you're the man, you're the CFO, so you have the answer. So what is the average cost per bed to break even?
So the current treatment rate, so we serve mental health beds. So there's 2 different kinds of beds in Maine, mental health beds and IDD beds. We serve mental health beds. The current rate of reimbursement is $607 for treatment. And then there's another $51, which we've mentioned for room and board. Sweetser's break-even treatment rate is $780. So you add the 50 to that, you've got $830 per day per kid would be our break-even rate.
What Okay, so 8 what now?
830.
And it doesn't matter how you get that 830, if we raise the 51 or we raise the treatment, either way,
Either way, we will.
You
be
need-
very happy
you need 830 a day just to break even.
to break even. Yes. Thank you.
Representative Zager.
Madam Chair. Thank you, Mr. McAnuff. Do you know of these 16 bed, the youth that were in these beds?
Mhm.
Did some of them end up in the emergency rooms that Maine Care is now paying for more expensively?
I mean, undoubtedly. So the 2 units that we closed, the first one was problemized sexual behaviors. So that's a very tough population to serve. So I imagine that those kids are probably out of state or somewhere where we don't have to think about them, right? Because they're such a tough area. And then the other one was our littles. So these were the under 13 group. And I imagine that they're probably, out there somewhere as well. So these are we didn't close for a lack of referrals. We closed for a lack of safe staff to serve these kids.
I don't know how familiar you are with how we do things around here in this state. Like most states, we have to get the price tag for a bill.
Mhm.
Sometimes it's in the bill, sometimes, but like
Sure.
it doesn't.
The fiscal note.
The fiscal note doesn't it's not a dynamic fiscal note. So we don't, it's hard to know what the actual costs are downstream and how, and so
Sure.
I'm trying to stitch this together. The state, if I understand correctly, state did not reimburse you to the $830 or whatever the amount is in other facilities. This has caused a major closure in services
Yes.
that has ripple effects. So Maine Care, 100% of these youth were receiving Maine Care.
Correct.
So now Maine Care is paying out of state providers, that can't be inexpensive, and also paying hospitals, and Ms. Calder and Ms. Harvey McPherson have been here many times emphasizing this. I'm trying to get a sense of the net impact. This is because clearly there's a
Sure,
human
yeah,
impact, clearly, and that's qualitative, and there's no way to measure that suffering. Sometimes this committee can move things in the legislature by saying, even if we just look at the numbers, do you want to spend a lot or a little?
Right.
So if there's anything you can provide for the work session of those downstream costs that we as a state are still incurring,
Sure.
that would help us.
So I think what we would need to accomplish that would be data from the department on how much they're spending out of state, or even how many. I'm looking for Adams. I see his feet. How many kids are sent out of state? Where that number changes every day, and we're not quite sure what that number is, or the cost associated with them. I'm sure our friends at Maine Health would be happy to work with us to share kind of what the cost that they're incurring in the.
I realize it's probably a complex query.
But I would love
But
to be on any committee that
is able
we
to be
recommend to be set up to investigate this, or to just be part of a solution. So
might be helpful for the work session, but I appreciate it. I know it's
Great.
not easy. Thank you.
Thank you,
And I appreciate the
Representative.
chair's indulgence.
Yep. Absolutely. Seeing no other questions.
Okay, thank you.
I just want to remind the committee of what the bill is asking for. Okay, the bill is asking that the department prioritize the rate. The department has moved the rate into the FY 2026 rate study list. So that piece of what this bill is asking for has been accomplished. The other piece of this bill is the establishment of $1 million fund that would be flexible enough to help the existing and struggling children's residential facilities to stay afloat while the rate study is ongoing. So that's what this bill is doing. And I think some of the questions around what the cost is, I think those numbers have been generated for us before. And I think we can ask for maybe that they be updated to reflect, 2026 numbers. But it's not a part of what this bill is asking for. just so that we're all on the same page here. Testimony and support.
Remarks, consent.
Welcome.
Thank you. Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee, thank you for the opportunity to testify today, and thank you, Representative McCabe, for sponsoring LD 2125. My name is Jane Van Bramer, and I am President and CEO of Sweetser, and I'm here in strong support of this legislation. Before coming to Sweetser's residential program and special purpose school, one young man felt trapped in a constant cycle of reactivity. He described himself as acting before thinking. His emotions quickly escalated. He viewed the world as a hostile place. He believed adults were out to get him. And when things became hard, his response was to run rather than face the problem. Today, his story is very different. After time in our residential therapeutic setting, he describes himself as being in a much calmer headspace. He learned how to pause, think through his actions, and regulate his emotions. His relationship with adults have also changed. Where there was once fear and mistrust, there's now understanding and connection. Several elements of the residential environment made this possible. Being in a healthy, structured setting allowed him to step away from negative influences and focus on his own growth. Time on our campus farm became grounding for him, especially the bond he formed with one of our horses named Tricky. It helped him feel safe and calm. Working in the mechanics shop gave him purpose and pride, reconnecting him with his roots and providing a positive outlet for his agency. This young person is no longer running away from his future. He's running towards it. Inspired by the care he received, he now hopes to pursue a career in nursing so he can help others the way he was helped. Stories like his show us that residential treatment works, but only if it exists. Maine's children's residential care facility system is in crisis. Over the past year alone, 111 CRCF beds were permanently closed. In April of 2025, 2 licensed CRCF providers closed, reducing in-state capacity by another 33 beds from 185 to just 152. If we fail to stabilize this program, more programs will lose services. Children will wait longer in inappropriate settings, rely more heavily on emergency departments or hospitals, or be sent out of state, all at a higher cost with worse outcomes. An emergency stabilization fund would help prevent additional closures, protect the programs that remain, and give the state time to implement longer-term funding solutions. We appreciate the recent Maine Care decision to prioritize rate setting, but without urgent action, more children like the young person I described today will lose access to care that changes lives. I urge you to act now to stabilize Maine's children's residential care system and ensure that children who need this level of care can receive it at home where they need it most. Thank you.
Thank you, Ms. Van Vermer. Questions? Seeing none.
Thank you.
You getting up, Betsy?
Very quickly.
Welcome.
Oh, well, thank you. And Happy New Year. It's my first time before the committee this year. Thank you very much for all that you do. I just was asked to play a little back cleanup here for just a couple of questions or a couple of things I wanted to say, and then I will put it in writing. I just want to talk about this bill and why we did it. And thank you to Representative Myers for reminding us where we are, and certainly to Representative McCabe for putting this bill in. All of you know that for many years we have come to talk about residential care services and the proposals. Oh, I'm sorry, I'm Betsy Sweet with the Behavioral Health Community Collaborative. And we've come up with various proposals. Some have been very large financial requests. Some have been changes in regulations. We've sort of done the gamut to try and all figure out what we want, the same thing, which is safe, good places for these kids to be. And this committee always, just want to say, always supports it and always passes it along. It often doesn't meet that same fate, unfortunately, with other priorities in the state. So this bill, we really tried to be very targeted and specific to say, what can we do realistically that will pass, that will actually make a difference? And that's why we asked for the rate change to be moved up, because we can't wait till 27 or 28 was when it was originally scheduled. And that's why we asked for the stabilization fund. We deliberately made the stabilization fund have very few strictures and left it to the department to work with the individual providers about how that fund would be used and what would be stabilizing. For some organizations, it would be, I need to pay for this 3-on-1 child for the next 4 months, or I'm going to have to close, or maybe they need some, we need a heating bill for this one. So we deliberately did not say, use it for this and use it for that, so that we could give, and we trust the department and to work with the providers to say, if you could just help us hold on for these 3 months, we can stay in business. And so that's why we did those two things. And I think the only other thing I want to say is that when we look at the rate review, and we're working with the department of this, we really want to make sure that they look at all of the things. There's some standard things, but like the head in the bed rule. And, if a child goes home to visit their family and comes back, like those, you can't just say to someone, a staff person, well, you go home too, and we're not going to pay you today because they're, it's good for their treatment to go home for the weekend, or, those kinds of things, or they're in the emergency room. So I think when we look at we really need to see a comprehensive look at the rate review so that it's adequate, and that we don't keep coming back to try and tinker with this, because we all want the same thing. The department wants the same thing. We want the same thing. And certainly the families and children need the same thing. So I just wanted to be really clear about why we ended up here with this now. And we're so grateful for your attention and always your support. Thank you.
Thank you. Questions? Seeing none. Nice to see you, Betsy. Anyone else in the room? I think we've got two, Sophie? Welcome.
Hello. Can you guys hear me okay?
We can. We're running a 3-minute clock. I'll give you a gentle
Great.
nudge when you're getting close, but you can get started.
Great. Hello, everyone. My name is Rachel Bousquet. I'm the Executive Director for Kids Peace, and thank you for allowing me to speak with you today. I want to say, I wish I was there, but I will tell you a number of my colleagues who have presented today have done an excellent and fabulous job. So I am not going to go over intensely what I had in my testimony, but I do want to hit on a few points. I do really want to mention, and I have been a strong advocate for a number of years, especially as it pertains to children in residential care. Our children in Maine, we especially know with those complex behavioral needs, really need our support. And that constant thought of thinking that if we don't take them, what happens? Well, we know that they end up in ERs, they're sent out of state, and they're typically in services that they need more comprehensive treatment for. What I wanted to make sure that I explained to you all today, and there's been some questions and I would love to be able to answer some of them. I was like jumping out of my seat as I was listening. But based on my direct experience, I've been at Kids Peace for 11 years now, and I'm in the thick of it. I am either providing direct care or providing different levels of supervision of treatment or overseeing the finances of it. But really, I urge the legislature to really think about strengthening the funding service overall. I appreciate the OMS moving the rate review into 2026, and that rate review must be comprehensive. That comprehensive must take into consideration geographic cost differences, regulatory and safety requirements for children, the cost of compliance. If I told you what my annual bill was for Joint Commission, oh my goodness, some of you, it's probably 1 to 2 positions in the sense of a salary of what it means to ensure that, we remain compliant. The value-based data-driven rate models. And this is not even to mention inflation, COLA adjustments, and capital improvements for our own structure. I also want to ensure that you understand how important it is to preserve the license bed that are established with this emergency fund. Currently, right now, out of the 6, 2 of them, and myself and Spurwink are the only 2 that provide ID and DD support to children in residential treatment. There's 2 facilities in the state. So if there is a child who comes across and they cannot be served in the other 4 locations in the sense of having a mental health diagnosis, And because some of them are complex, they could go either way. If Spurwink or myself do not take them, they will go out of state. They absolutely will go out of state. So the importance of ensuring that, especially with those high acute needs, that we are supporting those children in state. They are extremely vulnerable. And to think that they're going hundreds of miles away for rates of upwards of $950 to $1,200 a day, in locations of 365 days or longer in programs is outrageous. Also invest in a robust aftercare and reintegration support. I think that has probably been bled to death at this moment, but
Ms.
how
Muscat,
Yes.
could you wrap it up, please?
Yes, thank you. The
Just
last two
about hit
things,
3 minutes.
yep, and the last two things is around data, improving data collection and monitoring. We need a dashboard to know where these children are because we want to bring them back to the state, but that is unknown. That is an unknown anomaly out there, just so you guys are aware. And most importantly, bridging the funding during this reform system. We cannot afford to lose a single bed. I'm licensed for 49 children. Right now, I can only serve 22 kids, and over half of those children have autism. So it is really critically important that we're really trying to find the capacity here in order to support the rates and the programs overall in the state.
Thank you. Questions from the committee? I'm seeing none. We appreciate you being here.
Thank you.
Anyone else, Sophie? Yep. Welcome.
Good afternoon. Are you guys ready for me?
We are ready. You can get started.
Okay, great. Thank you. My name is Samantha Farrar. I am a licensed clinical social worker. I'm here with Kids Peace New England, and I'm here in favor of the LD 2125. So I want to talk a little bit about my role as a clinician. I'm a clinician at a residential treatment facility, or RTF, in the state of Maine, serving children. In my role, I provide a variety of topics, including individual and family therapy. Both of those are essential to treatment and requirements of treatment. But as RTFs continue to close across Maine, providing these services as well as other needed services for children becomes increasingly compromised. So in my role as a clinician, where I work really closely with families, I witness consistently the struggles that they endure in attempting to navigate services for their children. Any services, not just services that are readily available, convenient, or the services that their child may actually need. I also see families considering out-of-state placement more and more, and it really is a desperate solution to try to get any type of continuation of treatment for their child. In my clinical opinion, that is not a solution. It's a perpetuation of trauma and instability, as well as a misallocation of funds that should and really could be utilized in our state to improve these systems that already exist. So with the rate review and the subsequent increase in funding, children and families overall will receive better quality services that would really strengthen the impact of the residential treatment facility for families, communities, and for the state as a whole. And I think that this is especially true for the therapeutic family work. So as a family therapist, we know that family therapy is most successful when it occurs in person, and that in-person therapeutic component is coupled with frequent opportunities to practice integrating interventions and skills in real time with their children and other family members in their homes and communities. So I currently work with families who travel as many as 4 hours just one way to visit with their child. The families are stressed for resources. They're having to take time off work. We have many families asking for things like gas cards, even to make just a day visit feasible. Unfortunately, that means that oftentimes the in-person participation is sporadic and sometimes impossible. I know a number of us, even this weekend, experienced the winter weather, which sometimes is a huge factor for families. So these barriers to success are exacerbated exponentially when children are sent out of state for treatment. So if just for a second you can put yourself in the shoes of a child in Maine with mental health needs, you most likely have trauma and have experienced instability. You most likely have spent weeks or days at a number of times in emergency departments or hospitalized. You probably have already tried residential placement at least once, but your family continues to struggle caring for you.
Ms.
and now-
Farrar,
Yes.
could I ask you to kindly wrap it up, please?
Yes,
You've
thank
hit
you,
3
sorry.
minutes.
Okay.
It's quite all right.
Yep, I just want to end by saying that the families in Maine just urgently need this bill to pass. We do not have time to wait because more families will be separated when really we can solve this issue. Thank you.
Thank you. Questions from the committee? Seeing none, we appreciate you being here today.
Thank you so much.
Testimony in opposition. Testimony neither for nor against, but with additional information for the committee to consider. Requests for additional information from our analyst for the work session. It's a quiet bunch. Then I'll close public hearing. Anything for the committee to consider before we finish up for the day? Okay. Okay.
If you want to take the time and read them, officially.
Okay, thank you. So with that, I would entertain a motion to adjourn.
Tonight.